Today I want to talk to you about male menopause, or andropause as it's known. So male menopause or andropause basically means that as a male is aging, they're losing testosterone. And when they lose testosterone, they lose some of their vital function. Part of it is their energy and their stamina, their ability to be as strong as they were before. So their ability to lift can be noticeably different. And most men will say, I'm just not as strong as I used to be. I can't lift like I used to be able to do. Stamina could be exercise induced. It could also be sexual stamina. That can be an issue. Some men will experience erectile dysfunction. Oftentimes men will become more irritable or cranky, short-tempered, moody. Those kinds of things will start to happen. Some men will even start to notice that they're a little softer and maybe they're crying a little bit more than they used to, or they're more emotional than they were in the past. So these are all things that commonly we'll see happen as men start to lose testosterone. Now, most of the time men will lose testosterone after they hit about 55, but in some cases, especially if they're exposed to a lot of chronic illness, they may lose testosterone much earlier on, or if they're in a chronic pain state, they will lose testosterone earlier on as well, because that pain will eat up a lot of their testosterone, or the infection will eat up a lot of their hormones and disrupt their endocrine system. So it's not uncommon for men to experience hormone loss at different stages, and sometimes they can bounce back from that, but sometimes they can't. Sometimes they're just struggling with too many things on their plate and they can't bounce back from that. The other thing that can cause them to have some testosterone deficiency is adrenal insufficiency. So if they've been burning the candle at both ends for a long period of time, and their adrenal glands aren't able to produce testosterone and DHEA like it used to, or can't produce cortisol like it used to, it'll disrupt the rest of their endocrine system, and they'll have more problems with the testosterone deficiency. Now, testosterone deficiency can be identified very easily. It can be done either by a blood test or by a saliva test, and both can be done very accurately for men. And then we can see exactly how much hormone they have circulating in their body. And if they're starting to become deficient in that hormone function, then we can go ahead and we can discuss supplementation. We usually recommend bioidentical testosterone. Sometimes we'll use herbs if it's just a mild state of issues going on. We'll use something like tribulus. That can really help. When we look at supplementing with a testosterone supplement, we also want to look at what's happening with your estradiol function. So men can convert testosterone into estrogen, and it's called aromatase, or aromatizing estrogen, where you're going to make more estrogen out of your testosterone. And if that's the case, then you'll develop some man boobs or some soft tissue around your breasts. Most of the time you'll also start to get some weight gain around the midsection, which most of us no longer like to have. So those are the things that you'll typically see with too much estrogen. And now, when there's too much estrogen, we want to make sure we get rid of that right away. And sometimes estrogen can come from our environmental sources as well, but most of the time it's from that aromatizing from testosterone to estrogen. And there are a variety of different things that we can use. Something called DIM or IC3 can be used to lower estrogen. We can also use medication if we need to lower estrogen, should that be a problem and pretty severe at that point where herbs wouldn't help anymore, or the estrogen is too strong. You're making too much of the wrong type of estrogen, and we want to use something stronger. Then we will use something like Arimidex, or we can use something called Cryzin. Those are the two big things that we'll use to lower estrogen in men. So if you're having this problem, or you know someone that seems to be having some issues with testosterone deficiency, please reach out to your practitioner and have a discussion with them, because it's very easy for us to give them their quality of life back again. Thank you.